So I'm Sarah Leo, I'm the head of the Research and Innovation Office here at GMMH. I'm responsible for both the Research Office and the Research Delivery team. The Research Delivery team are out there with clinical services, working with them to try and maximise the opportunities that we can offer to service users, to carers and to staff to participate in meaningful research, high quality research that really improves the clinical services that we can deliver. So at GMMH we're already a very research active trust. We have a portfolio of around about 80 studies active at any one time. One of the difficulties we find and some of the feedback we have from both staff and service users is that they don't always get to see the difference that the research that they participate makes to clinical services, and sometimes it can take up to 10 years for that difference to come into effect. Some recent evidence suggests that actually just the very nature of us being a research active trust improves the quality of care that we're able to deliver. We're able to offer additional psychological interventions over and above other trusts that aren't research active, and that's a real positive impact of being a research active trust. So our research unit model here in GMMH is based on the successful model of the Psychosis Research Unit. The Psychosis Research Unit was established over 10 years ago and has been really successful in terms of co-production, so it's one of its many strengths. They've currently got 4 service user researchers and a very active service user reference group that's involved in all aspects of their research, from design to implementation and dissemination. The new units were established in early 2018. We have 5 new units focusing on youth mental health, CAMHS digital, complex trauma and resilience, patient safety, which includes suicide prevention and medicine safety, and dementia. All units are fully staffed. They've got a number of staff including research associates, research assistants, we've got a patient and public involvement coordinator and a clinical studies officer, and they're all doing really well in terms of their 3 main objectives. So they're looking at integration with clinical services within GMMH, they're looking at service user involvement, and they're looking at becoming self-sustaining within their first 2 to 3 years. And that's by bringing in grant income through the National Institute for Health Research and through collaborations with industry. So there's been a lot of successes over the last 12 months, particularly in relation to integration with clinical services here at GMMH. So the Youth Mental Health Research Unit have been working very closely with Junction 17 and Dr Sherman Imran, the lead consultant. They're particularly focusing on physical health in that particular patient population. Our Complex Trauma and Resilience Research Unit are working on trauma-informed care across psychological services within the trust, and at a recent event there was a huge amount of support for trauma-informed care, judged by polls within the event. The event was massively oversubscribed and we had about 100 clinical care staff attending. Our Patient Safety Research Unit are working very closely with the Substance Misuse team, so that's a fairly new partnership and has already resulted in funding for an additional research associate to focus on patient safety within the substance misuse service user population. So we've come a long way over the last 12 months, but we're always keen to continue to develop and to do more, to integrate more with clinical services and with service users. So if anybody wants to get involved, if they have any ideas for research, then they're always welcome to get in touch with the Research Office or the Research Delivery team.